On our morning show today from WRCO, we're talking about May is Mental Health Month. We've had some other programs talking about that, but we have members of the behavioral health staff from Health and Human Services in Richland Center here to join us today. Alicia Woodhouse, Alice Rettram, and Bella Candelaria are here to talk about the subject. And Alice, we'll start with you a little bit. Can you talk a little bit about the mission for Health and Human Services in this regard?
Hey, good morning. Richland County Health and Human Services, we are part of the Behavioral Health Service Unit, and our mission statement to the community is to serve as a resource to the community on mental health and addiction in areas of education, intervention, treatment, in order to promote an environment that is supportive to individuals seeking and obtaining assistance. So basically, we are here to help Richland County residents, whether it is a mental health issue, substance abuse, addiction, and to help assist the families as well, not just the individual person.
Kind of a one-stop shop then, isn't it?
Well, I hope so.
Yeah. But do you have individuals that are experts in the different areas?
Correct. So I work in our clinic, and with that, we have a part-time psychiatrist that is there on Fridays through telehealth. I schedule all the appointments with her for that. And then we also have a mental health nurse practitioner who is there about 8 days a month, and she is quickly getting filled up with patients. And then we also have Dr. Sainer, our psychologist, who does evaluations, whether you're kind of not sure what might be the cause of something or what's going on. We test children up to however old, and whether it might be ADHD, PTSD, depression, or even if they're on the autism spectrum. So we can kind of figure out, with the additional testing, to figure out how to help that person.
Who is eligible for your services?
Everyone that lives in Richland County. We only serve Richland County, so you must be a resident of Richland County.
You have a whole bunch of people that work there, too. I'm amazed at your staff.
Yeah, there's quite a few of us, and Richland County keeps us very busy.
We're very fortunate. So as we look at it, Alicia, are appointments important here for some of the things that Alice talked about?
Oh, certainly. If you, usually what you would do if you're interested is you would call the Health and Human Services office at the building, and the front desk would be able to direct you to the right place to answer your questions about making an appointment, and to if you need certain information, and they'll get you to the right person. You just call that number, 647 8821.
Good memory.
and then yes, and then particularly with Alice's her clinic, that's all by appointment.
Why do you feel a month like May, it's set aside for this? Why do you feel it's important to recognize mental health?
Well, and I think we're always talking about mental health, but it does, other things. Life can take the front seat and can become the front of your mind and the front of the conversation. And so just with like a lot of other months that are set aside to pay attention to cancer or to all the different things, you could think of a month for this and a day for that. It really does cause us to stop for a moment and increase those conversations and do it in an intentional way.
Lots of times, like if we have a physical ailment, like, oh, Phil's limping, we can see that Phil's got something wrong with him. But in terms of mental health, that's not always so relevant, or in the forefront, is it?
Exactly. And I think that is changing. That conversation is changing. That just like we have, we might have diabetes, or we might have, which that one you might not see, but like you said, Phil is limping, or that also mental mental health is important, and there can be illnesses, but there also can be mental wellness or mental not wellness, for lack of a better word. Just like if I don't get enough sleep and I don't eat the right food and I don't get enough exercise, I physically feel not great. It's this similar with mental health and mental overall health, that my overall mental health won't feel great either. I might be sadder, and then that's something that we talk about in Mental Health Month, is that mental health and also mental wellness is very important.
Taking care of you.
Mm-hmm. Taking care of you is correct.
Mm-hmm.
So do you have like classes, and do you have groups in those kind of sessions, or is that something?
Wouldn't that be something?
Well,
That
I'm
might
just
be something to look into.
Wonderful.
Yeah.
Certainly, we many of us know of resources to take classes, and actually there is, and often they are available to anyone, that any person could take them, and so that I'm certain most of us could probably point someone in the right direction if they were interested. But there are going to be some upcoming events that we don't have dates exactly planned. We've been working with the public health department, and we're trying to bring some more of those types of things. One of them is a program, it's called Make It Okay, and it's talking about, it's very directed at everybody. You don't have to be a professional to understand it. And so there's several of us who are we've become ambassadors to Make It Okay. And so we can give these presentations. So we are looking at some times. We don't have anything, but keep your eyes open for it. And that will be talking about just reducing stigma, how to have that conversation about mental health, because often that is a very uncomfortable conversation to have with your family members. And so just to really make it okay to talk about it with everybody, and what those conversations look like, and why it's important to talk about it.
Mela, that first call is probably the hardest one for somebody, isn't it?
Yeah, oh, definitely. I think oftentimes too, just even in my position, most of the referrals and things come in not directly from the individual, just because I think that is a hard first step for someone to take. And I think also a lot of the time people don't know where to go, which is why I think stuff like this, making it like public and saying like, it really is like you can just call right in, and we're available for that. Yeah.
And do you sometimes get referrals then from other agencies? How does that work?
Yeah. So specifically within, well, I guess, behavioral health in general. So like Alice, what she does, I work in the CCS program. So a lot of my referrals come from either hospitals, other like inpatient facilities, therapists, like outpatient therapists, and referrals can come from even just an individual themselves. But that's generally where we'll see it. A lot of our referrals come in through crisis. Really, a referral can come from anywhere. Police, just whoever is privy or aware of the mental health kind of situation at the time. Yeah.
Lots of times, of course, we're by COVID now, but certainly that didn't provide a lot of benefit for some people too. A lot of loneliness and things like that crept in. I'm sure you saw that.
Yeah, oh, definitely. I think COVID was not a beneficial factor as far as mental health, and especially for those again who were already feeling unhelped, alone. They were feeling, I'm sure, really isolated, and then that just kind of compounded that. So really glad that we've kind of squeaked through that little phase, and that we're able to start working one-on-one individually with these people again in that kind of way. Yeah,
I think it's important too, Alicia, as we look at making eye contact with somebody, and some of that one-on-one that you can provide. That's important, isn't it?
Yeah, and that one-on-one, that feeling of connection, that feeling of belonging, it is one of the real protective factors for mental health, but also to recover from mental illnesses. And so one of the things that we're taught is, like in this particular with CCS, is that mental illness, there's recovery from, it's not something, it's the sentence that you're always going to have these symptoms that are going to make it really hard to successfully navigate the things you want to navigate. So how do you recover? And it's the same way, it's many times it's a lot of the same things that also keep your mental health, keep you mentally healthy. So that's connection, and that's connection with your therapist maybe, or your service facilitator, which is what we call the people that kind of keep all the appointments, keeps everything straight. And then, but it's also those community events and those opportunities to be out in and just making connections with our neighbors and developing friendships, and those are a huge protective factor and a huge way to support recovery.
I'm sure somebody says, I don't want any medication though. I don't want to have, and that's kind of a fine line when you talk about getting over things. Is that kind of a hard thing to tackle?
Yeah, I mean, sometimes I think it makes it more difficult. It can sometimes when, it really does feel like it's a helpful, beneficial part of it. However, we're supportive of any kind of preference when it comes to mental health. And so we have quite a large array of different providers who can absolutely help, somebody manage or tackle or mitigate their mental health symptoms without the use of medication. If that really is something that would be more beneficial for the individual. 'Cause my whole thing too is like therapy doesn't work, and the work doesn't work if the client or the person is not, they don't feel comfortable with the treatment. So we're really good at kind of tailoring that, and again, looking at the person as an individual versus, this is what everyone should do, or yeah.
Every case is different, obviously.
Every case is different. Yeah, every person is different. I think that's what makes this, this whole mental health thing so unique and so also maybe challenging in ways, is because it's not a one fit to how we can treat somebody. One person might respond really well to one thing, and one person, it might actually be very detrimental and harmful. And so it's really just getting on their level, understanding who they are, what they have, again, what they respond well to, and then tailoring and customizing and hoping that, you can provide the best possible.
Right. The services we're talking about, Alice, is for all ages, obviously. We've done a lot of programs lately concerning the elderly. And I think that, elderly, that comes into play as well, again, with loneliness and things like that, doesn't it?
It does. And our psychiatrists and nurse practitioner, they do have older patients. We do have a few patients in the area, long-term care facilities that they manage the psychotropic medications for. But with Life Solutions at the hospital, a lot of them go through that program. And sometimes we will see them after they graduate that program to kind of continue the maintenance part of it, to kind of help them so that they may not have a relapse, and to keep them so that they keep coming. So that way, Bella talked about, the connections and keeping track of them. Not saying we don't ever let you go, but we want to make sure that we're there along the way to help you through it and to definitely maintain your mental health.
Life Solutions, they were recently on the program with us and talked a little bit about that. Do you work hand in hand with that program or not?
I don't necessarily think we work hand in hand, but I know Haley and a few of the other employees over there. So when I do have a question regarding, I don't hesitate to call and reach out and discuss, hey, I might have a person that might benefit from your program. And yeah, I think that's one good thing about our community. We're not too big, but we're not too small, and we all have no problems reaching out to each other.
Sounds like you're kind of the ringleader, Alice. Is that right?
Some days,
You tell people where to go, you know, and where they should go.
whether they want to hear it or
Well,
not.
absolutely. Alicia, do you help people with prescriptions? Because I know that's another big issue. Is that something that, or you can direct them to the right spot where they can go?
Well, I think Alice is mostly would be if I were to get a question on prescriptions, it would be that I would be directing them to reach out to Alice. In my role and several of our roles that we're service facilitators for some of these wraparound programs, we might help arrange an appointment with a like one of the providers that Alice works with, either Dr. T, as we call, or with Haley. But it's still Alice that's going through, and so then that would be the medication management is what it's called under our array of services in that wraparound program. And actually, so I work primarily with kids, and so there might be some that might be a subject that comes up at a meeting with the school if they're just to kind of coordinate with the parents and forms and everything. But Bella, maybe you might have more on that medication piece because you work more with adults.
Yeah, certainly. And kind of like you were saying, if they are, we do offer prescription services or medication management, as again the service array calls it. So that would allow anybody who comes in, especially through like the program I work with. They can get all of their all their prescribing services done through actually like our behavioral health unit by seeing again like any of our psychiatrists or psychologists. And so I think often it's actually easier for people just because they're already dealing with us on so many different levels. And then it helps like me as a service or a case manager, you know, I can help them if they're having issues or they want to change their prescription. So that's what's really great is like we can just kind of keep it all in one place. Otherwise, there is definitely like support for managing their prescriptions if they do have outside providers or they go to other pharmacies. But yeah, we're just here to support them in any way possible, especially around that because it can get confusing.
I'm sure it can.
Yeah.
Elisa, you talked about working with children too. How young do the children are they typically when they come to you for services?
So school age is typically what would work with the CCS program, or and younger than that it's harder to have therapy being. It's not that it would never be younger. I just at this point I haven't worked with anyone younger than school age. And it is really with kids. It's particularly interesting because it's really working with their families and the kids, especially the wraparound program. I think some of the outpatient when there was outpatient therapy. They might just only see the kid, and then that was only working with a kid. But with the wraparound programs, often the parents might also have some support that helps work with actually taking some of what is happening in therapy with the children and applying it to some of the challenges that happen within the home or at school. And so sometimes a parent, it's very overwhelming when you have a little one who already has little one issue. You know, you're already trying to navigate parenting, and then you suddenly there's things like ADHD or other mental health, depression, anxiety, things that often families feel very overwhelmed. And so the CCS program can, when they're working with the CCS program, sometimes that is something that helps.
Certainly, we find that it seems like a lot of people are needing help and needing services and reaching out. Is it more now than it was? Are things more diagnosed now, or how do you look at it, Lisa?
I would say yes and yes. I mean, I think it's more, and I also think there's more people are being diagnosed more. I had seen not that long ago just some of the numbers and increase of anxiety and increase of depression and other just It is. It is. It seems like it's going on this trajectory that isn't going in the right direction. But I would also say that there's a lot more universal screening that providers are doing, and even the schools are giving those referrals more quickly. And I think the families are more open to it too. So to going and getting, because they know that there can be those supports once there is a diagnosis, or once there is that, then both the schools are huge partners in having children both learn how to because often with kids it seems like what could help them so much is forming connections, but also some of the symptoms are causing those connections. It's really difficult for them to make those connections, and so there's this learning how to make social connections. It's not being able to do that gets in the way of being able to be academically successful, but also having healthy mental health. Mm-hmm. So the schools, they're a huge partner with in my world, and then the parents, and yes, I was trying to find I had a piece of paper that talked about how much everything is going up, because it is that this trends in the last 10 years for youth, 42% increase in Wisconsin, 21% increase in self-harm, that's not trying to commit suicide, but trying to harm yourself. And then 41 have considered suicide. And so those, of course, and then 52% of children or youth have reported anxiety, 35% sad or hopeless every day. And then there's some interesting things about sleep, like the sleep health. Not having enough sleep seems to be one of the impacts. And then, so there's like 74% of teens report sleeping less than 8 hours a day. And also where they need like 9 to 11 hours of sleep. And then, so when I would love at some point to have a conversation about screens and the increase of screens and how
that was my next question. My next question, Bella, is it screen time? Does that kind of correlate with what Alicia is talking about, or what is your opinion?
I definitely have. I mean, I think my own personal opinion, and that comes from my own personal use of it as well. There is definitely a correlation between the amount of time spent on screens and its like direct impact on mental health. It also, I actually just read some studies about the correlation between screen time and social media and like loneliness. And there is like increased feelings of loneliness amongst people who engage in like social media and screen time, just because it is such a very like overall, it's kind of like an ironic term. It's like social media, but it creates this very like alienating experience, very isolating. And so it's pretty much overall pretty detrimental. I'm sure that there are some positives to it, but as far as like mental health goes, it's not. Mm-hmm. It's not great, yeah.
And there are some, I think when I was looking for some numbers to bring here today, one of the, there was a pretty recent slide that I'd seen that it was like an hour. It's not saying that all screen time is completely bad. It seems like there's a correlation, like about an hour a day seems to be, there's often more benefits where it does like allow for connecting with friends or families that are far. It can be creative expression. It can be finding your tribe that are further out, that might maybe you live in a smaller town and you can't find anyone who really, really loves Dungeons and Dragons in the way you do, but there's someone in Madison who does, so you can connect with people that share your interests, and there's fun. I know I'm guilty of playing games on mine or watching a video or something, and I don't know about if guilty is the right term though, because it can be used in that fun way, and there's also lots of learning that can happen I've seen my own children really get interested in something and they're able to dive into the subject in a way that I couldn't even have imagined when I was a kid. But the risks of when you're over an hour in a day, that's where it gets. And some of the numbers are that a lot of kids are on 8 hours a day. I mean, it's huge, and it surprisingly, I thought, oh, that's a huge number. And then there were some summer days that I was maybe letting my children choose how often they were on, and it was close to 8 hours a day, and I was feeling like not doing a good job as a mom.
Not the Mother of the Year award or
No.
anything like that. But I think preventative is another word that we can use here.
Oh, exactly. And while they were speaking, I was thinking of how, not to divulge my age, but years ago, how we complained and stuff about the TV, watching TV, and now it's social media and computers and your cell phones and yes, of how to balance those things. And when they were talking, also I was thinking of that this is another reason why it's so important in our communities to have these programs and to be out in the community, because I've had some patients that said, oh, I never knew you guys had this program or this or that. So it's really important that we get our pamphlets out there, and we do radio shows like this, and we're at the hospital, and we're at the other clinic, and I know we do have a lot of information like at the libraries and the senior community center, places like that, just so that people are aware that there is help out there, we have Northwest Connections that is part of our crisis, and you can call them not only for a crisis, but to get information of, what this is what I need, this is what I'm feeling. We've had people call the crisis line just because they had nowhere else to turn to. So we were able to inform them about the nationwide 988, the 211. There is so much out there, but we have to get it to the community so they're aware of it, and to hopefully to get part of programs to prevent some of the social media things and watching too much TV. And when we talk about mental health, it's like, okay, and especially with kids, well, even with adults, I know when I talk to people, it's like, okay, and we talk about coping skills when we're a little anxious and things like that. And now that the weather's getting nicer, let's go for a walk. Don't have to walk a mile, around the block. Or if you don't feel like walking, just go sit out on your front porch for 5 minutes, watch the traffic go by. Or if somebody walks by, say hello. You never know what might happen. Conversation might strike up, and we all know once you get outside in fresh air, you feel better.
You do.
Yeah.
What about coverage in terms of insurance? Does that come into play?
Insurance. So I don't work in the billing department, but we do take Medicaid, Medicare, private insurances. Some, I'm not exactly sure which ones, but yeah, we'll work with it.
Sure. So no one should worry about that in terms of
No. Your
calling.
mental health is number one. We can figure everything else out later.
Yeah. May is Mental Health Month, and we're doing some special programs here in the morning show, and it takes a special person to do what you guys do. And I thought maybe I'd pose the question of this. Why do you do what you do? Because I know sometimes it's a tough occupation, and, there are a lot of victories, but I'm sure there are some disappointing days too.
I
Alice?
know most people are probably going to say, oh, because you want to help people
Right.
or things like that. I always wanted to be a nurse, and so I worked 30 years in long-term care, from CNA to administrator, and then about 5 years ago, the opportunity came up to work behavioral health psychiatric. I worked with geriatric psychiatric, so I was familiar with that. And I thought, yeah, let's do a change. Let's come to the county and see what I can do. And so it's been enlightening. It's been a challenge because I did not work with children before. It was the older adults. So I guess to say why I like the challenge and to try to fix things is That's probably one of my character defects. I want to fix everything. And with mental health and like diabetes and things like that, working with people, you can't fix it, but we can kind of guide and support and help people.
Sure. Well said. Alicia?
I don't know. I don't know the answer to that. I think I really like people. I really, really like people, and the more different types of people, and I've always really been interested in why people make the choices that they make, and I kind of want to hear about why they make the choices that they make, but then also understanding some of the underlying, I guess, reasons that maybe they don't know why they're making the choices they're making, and then I guess being with kids particularly, just how parents and our community and our schools, how we have such a huge impact and in their development into healthy, happy adults. I guess I wanted to be one of the people that supported that while appreciating people with all their varied, interesting things about them.
No day's the same, I'm sure.
No day is the same. No hour is the same.
What about you, Bella?
Yeah. Well, I think it's kind of a bit of all of that. It's definitely multi-factored. I had my own personal, really beneficial experience with mental health services in general, and I think that's what really pushed me into this field and pursuing this a career in mental health. To piggyback off of Alicia, definitely the psychology of it really interests me. But I think at the end of the day, my biggest motivator is not to sound as simple, but I want to help people, and I think that we're all entitled to feeling the best that we can and happiness. And, we're only on this planet for a tiny little amount of time. And it just breaks my heart to think that anybody's experience would be, tumultuous in any way. So I just get really motivated by if I can help somebody manage or get through or, just have a brighter life. Yes. It's very rewarding for me. Yeah.
Awesome. Well said. So if somebody's hearing this, can benefit from any of the services, what's the best number to call? Where should they start, Alice?
608-647-8821.
Is there a crisis line as well? That number for the county or nationally there is too?
Yeah, nationally there is the 988 and there's Northwest Connections. Mm-hmm. Mm-hmm. And they can call the police department. The police department can hook them up with Northwest also. I mean, it's not just, they could call the hospital too, and they could hook them right up. Walk into the ER department, and they can do that too. So there's plenty of ways. They could definitely call and walk in.
All right. Thanks for being our guest today on The Morning Show.
Thank you.
Appreciate it. Behavioral Services from Health and Human Services, our guest today on The Morning Show from WRCO. Thanks to Alice Rettram, along with Alicia Woodhouse and Bella Candelaria for being our guests.